The reason for the speedy success of these various endeavors, of course, is God's grace and the fact that we adopted a strategy of working with all the local councils and all the people within the ministries. So this was not by any means an up-down approach, but very much a networking approach where we invoked all the help that we can get from the local councils. And we are very grateful to the local council of Tripoli for a tremendous job on the various sectors, and also the local council of Misrata, the local councils in Jabal Nafusa, in Zawiya, and other places. They've come forward with great help. Also, our colleagues in the various ministries and the various governmental entities have shown great heroism. Special mention should be mentioned of the 9 or so engineers that went on site in Jabal Hassauna and risked their lives to bring back the water to Tripoli. And we are immensely grateful to all of them. As you know, the stabilization team consists of many people, and many of our colleagues, of course, are not here with us. It would be hard to put 70 people on this small stage. But some of them did manage to make it, and one of them is Dr. Salah Busnina, who will brief you on the efforts in the health and the humanitarian sector. Please.
Assalamu alaikum. Good morning, everybody, and thank you for your time. My name is Dr. Salahuddin Abu Snana, and I'm Medical Director of University Hospital Sharjah. What I would like to do briefly is to brief you about what's been happening during the last 6 months and what are the Libyan doctor overseas done through the crisis. And my speech will be 3 parts briefly. The part number 1, I'll speak about the crisis medical team work before the stabilization team, then through the stabilization team, and at the end I will mention a few lines about the handover to the Ministry of Health. When the crisis started, there are lots of doctors network all over the world, in Canada, America, here, try to form a committee to help the Libyan people. Then we made effort to join all these networks to one network called the Medical Crisis Team. And that's to organize the medical aid, which include the medical supply and the medical personnel to Tripoli. And all that was with collaboration with the international community and lots of the NGOs. During the crisis, there was a continuous contact with the Libyan doctors on site who are on the front line, and the Libyan doctors overseas on the front line to take the list of medical needs, and again the need for the doctor in different specialties. And that's we're working in different area according to where the sort of the liberation and the fight was. The second thing is there was then we get the whole Libyan doctors network become under the stabilization team to work together with the stabilization team and to plan during and after liberation of Libya. Before liberation of Tripoli, we formed a team which called to draw a plan. We call disaster plan for Tripoli, and that was included storage places in Jerjis and about 6 to 8 clinics inside Tripoli, just in case disaster happen in Tripoli. So we will be prepared to do that. And thank God, liberation of Tripoli went smoothly. And so what we have done, all the effort which has been done to serve Tripoli crisis, been devoted to the remote area like the Western Mountain and Tarhuna and the Sabha, where the fight still continuing. We're still working on the crisis team to provide help for the medical supply and the doctors to the area, Sirte and Benulid and Sabha. On the same time, we have what we call the advisory committee, and this advisory committee, it's about 10 people of the doctor's expertise to provide the advisory for the Ministry of Health and advisory for the crisis team, which working on the medical field. And we're working on few programs. Those programs are the amputees, those people who are got amputated during the war, and the rehabilitation program. And we draw a full plan, which is handed over to the Ministry of Health to pursue rehabilitating those people. The second program is the post-trauma psychological distress syndrome, which led by a local doctor here from UAE, Dr. Fadwa Al-Mgherbi, which is again being handed to the Ministry of Health to continue that effort. The other thing we are doing is what we call the quick fix for the health reform, and that's to get all the hospitals sort of working in the original capacity before the crisis. With the help of the stabilization team regarding the energy and water, we were able to get enough doctors and enough medical supply for the Tripoli hospitals, most of the major hospitals and teaching hospitals in Tripoli, to perform their work. On the same time, we, as we have enough numbers of doctors in Tripoli, we start devoting doctors from Tripoli to go to the remote area. Just last night, we have two teams traveled from Tripoli to Benulid, and another team went to Misrata, and those are from the local doctors. Our plan now is to hand over our work to the Ministry of Health, with us helping them as advisory committee with the future plan of the health reform. So currently what we are doing is we have 3 or 4 committees dealing with the injured people and planning for their treatment either overseas or locally. And those committees are basically going through every hospitals, and even the injured people, they are staying in their homes, first of all to survey the injured people and to go through a committee which is consists of different expertise from the different surgical specialties to take like a detailed report and decide when and where and where to go to do the further reconstruction surgery. That work includes Tunisia as well. There is a committee in Tunisia to go through all the injured people in Tunisia. Our work currently, it's all in collaboration with the Ministry of Health, as we're trying to hand over to them. I think this is just a quick brief about what's been done, and this work is being done by all the Libyan doctors, and I'm here just like a spokesman or coordinator of all these committees. And I would like to thank all the Libyan doctors, as I couldn't find anybody who's hasn't been involved in this effort in everywhere in the world, Canada, America, Europe, here in UAE. At the same time, big thank to our local doctors who's been in contact in spite of their security was really at risk at the time of when Gaddafi is still ruling Tripoli. Thank you very much.
Thank you very much, Professor Dr. Busnina. I would like to add that we are really truly grateful to the local councils of Tripoli, Misrata, Zawiya, Tarhuna, and various other local councils. The doctors in those councils and the committees in those councils have been working very closely with our team and with the Ministry of Health, of course. Special thanks are also due to the forensics team that came from Misrata to help with the identification of unidentified bodies in Tripoli, and that is helping to set up a committee under the Ministry of Health for this purpose as well. I would like to point out that, we are all happy that Tripoli is liberated, but we have to remind ourselves that our brothers and sisters still are suffering in the south of the country and in other parts of the country, and that the fronts are still, unfortunately, generating large numbers of injured. Special thanks to the Kingdom of Jordan and the Hashemite Kingdom of Jordan for accepting injuries. Last night and the night before, injured youth have been arriving from Misrata to Amman. using Libyan airplanes, and I think starting today, some Jordanian aircraft with support from the UAE. And we are grateful to all the great people that have made this possible, from Mohammed bin Ras Ali, who is coordinating locally in Libya, to Mu'in al-Kikhya in Amman and his team, and to Mun'im Bououd, who's arranging for the aircraft arrival. All these people are now focused on evacuating as many injured people as we can to Amman. We take this opportunity to urge the world community to continue to help us with treating the injured in Tunisia and in Amman, and to take especially difficult cases to France and Germany and the UK and Italy and other places. We need all the help that we can get for this humanitarian effort. We also would like to point out that the South is in huge need of humanitarian aid. Our team in Tripoli is in close contact with the UN regarding the food and medical and water and fuel needs of the south of Libya. But as it gets liberated, these towns and cities are in great need of help. We're talking about over 500,000 people in the Sabha area that will need a lot of help. So the world community, while celebrating the victories with us, not to forget the suffering that continues. And that is, for us, the number one focus. Stabilization team or unit, we're now totally focused on the humanitarian and medical needs of our people. I would like to invite Mr. To talk to you about the financial sector, and then Mr. Hatem Al-Gharyani can also help with the international finance dimensions of that, please.